For people with high blood pressure, a combined routine of aerobic exercises with some series of muscle work can help us to stabilize our tension. In addition, later relaxation techniques will help clear the mind. High blood pressure is what is known in medical terms as hypertension. It is one of the most common cardiovascular pathological, which occurs when the pressure in the arteries is excessive and causes the heart to charge more. For some time has been warned about the risks involved in suffering this condition since, although it is usually silent, its consequences can be lethal. Many health agencies are now promoting the adoption of a healthier lifestyle, as it has proven to be the best way to prevent this disease or at least keep it under control. One of the habits that can have a positive effect to balance it is the regular practice of physical activity. Although in ancient times it was thought that physical involvement might have negative repercussions on the heart, since 1989 the World Health Organization, WHO, and the International Society of Hypertension accepted this habit as a non-pharmacological measure for reduced blood pressure values. What are the benefits of an exercise routine? Without pretending that a person with this type of cardiovascular disease adopts a plan of exhaustive exercises, it is good to point out some important advantages of this practice to improve this condition and health in general. One of the most notorious and important is the ability it has to help burn fat, especially with everything that has to do with aerobic activity. Thanks to this benefit, cholesterol levels are reduced and the optimal state of the arteries, the circulatory system and the heart is guaranteed. By improving blood flow, there is greater oxygenation of the tissues and, in turn, increases the ability to remove the fluid retained there. In general, its regular practice represents a lower incidence of strokes, myocardial infarctions and other pathologies that can affect the quality of life or even lead to death. Of course, it is worth mentioning that its constant realization has a positive effect on reducing stress and anxiety, emotions that influence blood pressure readings above what is due. Recommended exercises. The following exercises have a positive effect on patients with high blood pressure, as it can help control it naturally. However, it is always good to do a previous medical consultation because in special cases a custom routine is required. In any case, to be more effective, this plan to be composed of 3 basic practices: aerobic activity, muscular work, relationship techniques. Bicycle exercise. This physical exercise is advised as resistance training. It strengthens the cardiovascular system, activates the metabolism and also improves the body's immune response. In addition to this, it is a great option to tone and strengthen the muscles of the legs and back without overloading the joints. How to do it? To start, it can be done in 20 to 30 minutes. Whether it is a static or classic bicycle is the patient's own decision. It is usually recommended 3 times a week, but if you can more days, much better. Dance. Dancing is one of the funniest and most effective cardio exercises you can do. By involving a constant movement of the whole body, it contributes to improve circulation and increases the rate of metabolism to burn fat. Its regular practice can be very effective, as it lowers cholesterol levels, controls blood pressure and also fights stress. How to do it? An interesting way to turn it into a routine is by practicing Zumba. This type of therapy usually lasts from 30 minutes to 1 hour. Stretching of the legs. The constant movement of the legs helps to improve circulation in this difficult area and prevents the heart from overloading. Because of its ability to relax muscles, this stretching exercise can eliminate tension knots that may be making it difficult for blood to pass through. How to do it? The body should be erect, with the legs together and the arms stretched forward. Now, bend your torso forward in an attempt to touch the tips of your feet with your fingers and hold this position for a few seconds.